Hi everyone, thank you so much for coming. The next session is going to look at the commitments made by the Scottish Government to tackle mental health stigma and discrimination. Over the last year, the Scottish Government has done a huge amount of work to create 3 new strategies which aim to improve the lives of people with mental health problems and those in distress. In this session, we're going to look at what they're saying about stigma and discrimination, where stigma impacts on people's lives, what the result of that stigma is, and how they want to tackle stigma. We've pulled out key actions relating to stigma and discrimination across the mental health strategy, the suicide prevention action plan, and the draft self-harm prevention action plan. At the end of this session, we want to have considered what actions we can develop which would tackle stigma across the 3 strategies. In a time of tight budgets and stretched services, we want to take an approach that will ensure that work is not duplicated or tripled and can have the biggest impact. If we are to ask ourselves why we're here and why is this group important, then really we need to look no further than the visions of the 3 strategies. They all contain an explicit mention of stigma. This demonstrates how fundamental tackling stigma and discrimination is to truly meeting the vision of the strategies. We are in a position to be vital in achieving these strategies. Whilst all 3 strategies are key, the one we're tackling, mental health stigma, is absolutely core to the strategy being achieved is the mental health strategy. The most important section for us in that is this, the priorities. The Scottish Government is currently creating a delivery plan for the next 18 months, which will form the first steps of how to achieve these priorities. As highlighted in the first presentation, one of those actions is the creation of this expert group. And part of our role as an expert group is what we think needs to be done to achieve these priorities going forward. In the strategy, there is a table which highlights challenges to delivering these priorities. 8 of the 10 list stigma and discrimination as a challenge to achieving them. The 2 that don't are highlighted in red. However, we believe that we do need to consider the impact of stigma in these healthcare related areas. Our SPIS findings show that 87% of people with mental illness have experienced unfair treatment when trying to get help for mental health problems in the last 12 months. The impact is people not reaching out for help when they need it, with more than half of who have experienced stigma in this area saying they have avoided calling an ambulance or attending A&E for emergency mental health care. Further, in physical health care, 85% have stopped themselves for asking for help for physical health problems. This slide shows stigma pulled out in its most basic form across the 3 strategies. We can see here that stigma is so widespread it can impact nearly everything, such as help-seeking behaviours, how people interact in relationships, and hinder opportunities in work. The strategies have shown different areas where stigma impacts people, including self-stigma, stigma in workplaces, stigma in communities, public stigma, and stigma in mental and physical health care. We have gone through the 3 strategies, looked at where stigma comes up, and looked at the context of where stigma needs to be addressed. From this, we identified 7 key areas where stigma is impacting people's lives in Scotland. These 7 key areas have been made into themes to shape the thinking of the group. For the rest of this presentation, I will be taking you through a summary of what each strategy says under each theme. There is a huge amount of information in all the strategies, so I've tried to summarise into a few key points under each theme. For a lot of you, these themes won't come as a surprise and it won't be groundbreaking, but that in part is why this group is so important. The impact of stigma in the areas we're about to look at has continued over the years. We have pulled this group together to tackle this and to go further than we have before. Once we have looked at the 7 themes, our next breakout session will be to think about actions under each key theme. Theme 1 is that stigma stops people accessing support at the right time. All of the strategies provide a commitment to ensuring everyone gets help at the right time, with an intention to tackle stigma and discrimination. The self-harm and suicide prevention action plans identify that stigma is a significant barrier to help-seeking behaviours, with the Self-Harm Prevention Action Plan emphasising that self-stigma impacts those reaching out for support. The mental health strategy identifies that stigma will provide a challenge in creating a whole system, whole person approach. All strategies acknowledge that this work also needs done with and for specific groups or marginalised communities. Here we need to consider actions that impact people accessing services and receiving the support they need due to stigma and discrimination. Theme 2 is all about how stigma impacts in our relationships. All strategies highlight that mental health stigma can have a significant impact on creating and sustaining relationships. They all acknowledge the importance of providing information to those closely supporting people with mental illness, for example, parents, friends, and carers. This is consolidated by the mental health strategy, which references taking a collective approach to understanding and a shared responsibility for promoting good mental health. However, the Self-Harm Prevention Action Plan is distinct as it flags how stigma can impact the support for those supporting people that are or have self-harmed. Providing information for those who support others can strengthen people's understanding to best support people and reduce mental health stigma. Again, in the strategies, they all highlight higher risk for marginalised groups and the need to take an intersectional approach. This is something that we need to consider, for example, taking into account cultural differences relating to the term mental illness. Theme 3 shows the difference we can make if we tackle stigma in communities. To address stigma, communities need information on mental health and the impacts of suicide and self-harm. The Mental Health Action Plan draft says we need to know more about where stigma happens to better support communities at risk of stigma. The Suicide Prevention and Self-Harm Prevention Action Plan flag areas where information could be provided to tackle stigma, such as in libraries and financial advice services. We need to know more about the impact of stigma in communities where there are higher instances of suicide or self-harm. The strategies acknowledge that each community approach is not a one-size-fits-all, and learning events and peer support can address stigma in communities. Theme 4 pulls together what the strategies are saying about the impact of stigma on young people. Young women are a key target audience highlighted in the Self-Harm Prevention Action Plan, a group for who the impact of stigma can have a huge impact on getting help or speaking to others. The Suicide and Self-Harm Prevention Action Plan commits to providing age-appropriate resources. If young people are to understand their experiences and be able to speak about them without fear or judgment, then they need to understand them. The Suicide Prevention Action Plan also flags investment of time and training for those in schools to identify the signs of suicide, with the Mental Health and Wellbeing Strategy prioritising a lifespan approach, which contribute towards targeted actions for young people. We know that education can empower people to speak out about their experiences, especially in an environment where there is shared understanding. This could encourage people to disclose and reach out for help at a younger age. The Mental Health and Wellbeing Strategy commits to improving mental health support with reduced waiting times and improved outcomes for people accessing CAMHS. When we discuss actions, it's worth thinking about the impact of stigma and discrimination and lived experience involvement with a diverse group of young people. Theme 5 groups together the areas that stigma impacts those in systematically marginalised communities. Communities who either face increased stigma, stigma for multiple reasons, or for who the impact of stigma is the greatest. Every strategy makes a commitment to taking an intersectional approach to care. The mental health strategy focuses on building the evidence base for marginalised groups. All of the strategies commit to working with organisations to understand the needs of different marginalised communities. The Self-Harm and Suicide Prevention Action Plan commits to providing information to groups, capacity building and supporting learning. But what evidence do we need around stigma is a question we need to ask ourselves. It's key here to think about the disadvantage that some groups face due to the way that systems are created. Here we need to consider the journey of people reaching out for support, beginning with experiencing symptoms, all the way up to accessing services, including a diverse range of cultures. This theme requires actions that consider the whole person in context, rather than reducing people to individual characteristics. Here, we need to commit to ongoing, meaningful engagement with systematically marginalised groups to understand barriers caused by stigma and solutions on how to tackle it, as well as how to co-design appropriate supports and services. This theme should be continually highlighted throughout all priorities to ensure it is not lost. When considering action, it's helpful to ask, who do we mean when we refer to systematically marginalised groups? What should be written into policy or actions that would make this meaningful? It's important to acknowledge that stigma is not experienced equally and in the same way by all, and we need to be open to considering broad definitions and wider contexts which impact on the root causes and experiences of stigma. Theme 6 brings together the information on how and where we need to address stigma within and for the primary care workforce. All of the strategies commit to embedding time, space, compassion into healthcare practice as a means to support people. These principles could be key in tackling stigma. If people receive compassionate care, are given space to talk about how they are feeling, and time to get help, they are far less likely to feel stigmatised. Both the Self-Harm and Suicide Prevention Action Plan flag the importance of providing workers with appropriate information to support people experiencing mental illness or at risk of self-harm or suicide. Education is vital in tackling stigma, but where is the best place and when is the best time to educate on stigma? The self-harm prevention strategy flags that the broader primary care force should be provided with suicide prevention training prior to full registration as a healthcare clinician. Here we think about factors such as how stigma and discrimination may impact disclosure or support seeking to healthcare professionals. The strategies all flag support for the workforce. Here we think about workplace cultures and disclosure to managers and colleagues regarding mental health issues. Our Smith's findings show that those with severe and enduring mental illness are reluctant to reach out and work for fear of being passed over for promotions. The Mental Health and Wellbeing Workforce Draft Plan flags that mental health care workers may experience stigma within their field from their peers. When we discuss this, it's worth thinking about the impact of the workplace environment, the workforce settings, and workforce cultures within the sector. Thank you so much for listening.